pain she's having is numbness and tingling. She has interscapular pain, meaning between her shoulder blades. She talks about having tightness in her neck region or cervical region. She has some mid-back pain. Mostly it's held in her shoulder region. She also has numbness and tingling, mostly on the right side, beginning with her ring finger and her pinky finger.
So I was feeling really good, no pain until last Wednesday, and then on Thursday and Friday I had pain, but it's alleviated a little bit. It's
Okay.
gotten a little bit better.
When you say you have pain, what type of pain?
Same as last time, like
Okay.
shoulders, back, and then my wrists and elbow when I extend them.
Mm-hmm. Okay.
And then tightness of the chest and neck.
Any numbness or tingling?
A little bit on the fingers, but not too bad.
Okay, both fingers or just on one side?
More on the right side, like this finger and this finger.
Okay. And so we treated you on Thursday, which would have been a week ago. Mm-hmm. And it lasted about a week of treatment.
Yeah.
That's pretty good.
Yeah.
That's pretty good. Okay.
Yeah.
Anything else? How's the sleeping at night?
Sleeping is good. Yeah. I get sleeping is fine. I'm not waking up in pain. The only time that I have pain is the first thing in the morning when I wake up.
Okay.
Just getting up.
Okay. And describe that when you first wake up. What tends to happen when you first wake up in the morning?
Mostly my back. My
Okay.
back is really
Mid back or low back?
like the scapula area.
Okay.
Yeah.
Mid back. Okay. What I'm going to do is we'll do two ranges of motion. I'm going to have you laying down like this, and we'll have you sitting up. Okay.
Okay.
So we see the difference.
Okay.
If you can do me a favor and just turn to your right, and then turn to your left. Okay. Take your left ear to left shoulder. Take your right ear to right shoulder. And to there. We'll do it one more time so they can see it. And then the other side. And you can tell here this is limited on that side. And then go turn to your left. Limited there. Turn to your right. A little bit better there if you see that. Mm-hmm. I'll have you seated.
Okay.
Facing me here. We'll do the same thing. Tristan's going to look up for me. It's a better range of motion when she looks up. Look down. Limited when she looks down. Turn to your left. Okay. Turn to your right. And limited when she turns to her right. Okay. Take your left ear to left shoulder. And then take your right ear to right shoulder. And limited there when she does lateral flexion. Okay. So we'll start on your back.
Okay.
What I'm doing today is called fascia manipulation. We have fascia all over our entire bodies, and it's a system, it's an organ system. It contains neurons, and it also contains muscle spindles. Those muscle spindle cells control the length and strength of a muscle. And so, technically speaking, we can manipulate the fascia and increase the length and strength of an individual muscle. And we can also decrease the pain, decrease inflammation. And finally, we can actually have better communication between the brain and the spinal cord in movement. So this is incredible technique. And once again, it's called fascia manipulation. Here we go. What I'm gonna do that's very unique too is today I'm only going to work on her face, but I'm not gonna work on her neck, okay? Last time I believe we worked on your foot, right? Mm-hmm. And your hips. Did you get relief from that, doing that part?
Yes.
More than the face? Because we'll do what gets you more relief.
I think so. I think we worked on this side, the leg, the entire leg, and that really helped.
So, okay, so check this out, guys. This is impromptu. This is something that we haven't worked on or even talked about. I'm going to switch it. Instead of doing the face, I'm going to work on her feet, her legs, her thighs, her hips, her mid-back and low back, and a little bit of her thoracic region. And I won't even touch her face, and I can guarantee she'll have instant results. Check this out. So here we're gonna do a quick scan, and then we'll come back and we'll look at post-treatment at this point, okay? Any pain, discomfort?
A little bit.
Give me a number between 1 and 10.
3.
Okay. And how about here?
2.
Okay. How about here?
5.
Okay. How about here?
Yeah. 8.
8. Yep. How about here?
7.
7. Turn on the side, facing this way, on the side. Okay. How about here?
7.
Okay. On your back now? On your back. I'm sorry, my stomach. I'm sorry. I need to get on your back. Again, we're just scatting. Arms to the side. Give me a number.
3.
Okay. How about here?
6.
Yep. I'm on it. How about here?
4.
Yep. How about here?
7.
7. So what I'm going to do is I'm going to work on her fascial plane that I've determined, and then we'll come back and we'll look at post-treatment, okay? See you guys in a moment. Okay, and now we're just going to look at her hip range and just kind of figure out what's going on in her hips. Again, we're not going to touch her hips today, but as a result of doing the fascia manipulation, you might see some instantaneous results when it comes to her hips. Check this out. Put your thumbs here, Tristan, right there. Perfect. When the thumbs move back, look at that, it moves back right there. Less than 25 degrees. We'll do it here, less than 25 degrees. I'll give her about 15, 20. We'll do it one more time so you can see the thumb movement right there. And again right here, okay? So those hamstrings are really tight and pulling on her sacrum. We'll look at hip flexion. She's really flexible. And let's look at true hip flexion. We want to take the knee, and it needs to go past 90 degrees. This is 90. We want that knee to go to the shoulder. I can't do it. And she's flexible, she's female. Look at this. That's 90. I push back a little bit more, tight there. We'll prove the point. I'm gonna use my 2 fingers. Look at her neck when I try to push forward. Just watch her neck. Resist me, Tristan. There we go. See how she's resisting, but she's using her back and her neck. We'll do the same thing here. And still again. And the reason why it's tight is because she sits for long periods of time. Most of us do. And we also drive for a long period of time. We're using that psoas muscle when it gets really tight, overreactive. And again, she's using her back to compensate. We'll stop there. So again, we'll come back and look at post-treatment at her range of motion for her hips, her neck, and we'll compare notes. Appreciate you. So now we're at post-treatment. Put your thumbs right there, Tristan. Immediately, here we go. Now let's look at after treatment, post-treatment, her thumb right here. Now that's just crazy. That's crazy. And we'll do this one. Look at that thumb.
Wow. That is impressive.
Now we'll look at the hip flexion. Remember I said it goes past 90? Check this out. It just goes.
Just goes.
Look at this one, say out of your shoulder. And then I won't tell the audience how much you weigh, but I'll tell the audience how much I weigh. I'm about 225, 230, between that. I'm gonna hang on you basically and just resist me, okay? Here we go. Now that's just crazy. And you can see her neck muscles not even moving, and she's able to hold me. The reason being is because a long muscle is a strong muscle. But the main point is we're looking at her neck. So just look at her neck and see what happens with her neck. So now turn to your right. Now turn to your left. She couldn't do that before. On her left, you see the difference? One more time, turn to your right and turn to your left. Take your right ear to right shoulder. And take your left ear to left shoulder. Okay, now we're doing it seated position. Go and look down. Okay, look straight. Turn to your left. Much better. Turn to your right. Oh yeah. Take your left ear to left shoulder. Take your right ear to right shoulder. So everyone knows that I didn't make this up. Did I touch your face or your neck today?
No.
What did I touch?
My legs.
So
My feet.
I treated her feet, treated her calf, treated her thigh, and a little bit of her glute region and her lower back and mid back, and she has no more neck issues as far as tightness. She can now turn to the left, turn to the right, do lateral flexion, and she has good range of motion. How do you feel?
Good.
All right.
A lot better.
Absolutely. How many treatments have we done so far?
I think this is the third one.
Third treatment, and we'll keep you guys posted on the next episode. Thank you so much for watching. Appreciate you. Like I say, results don't lie, we over deliver.